In the news this week, your priorities versus the government agenda. Our exclusive annual budget priorities poll reveals whether the state budget aligns with your needs.
No more power credit relief from the state government this year, as household fees and charges are set to rise. Peter Kennedy weighs in. GPs to diagnose and prescribe ADHD medication as the number of cases continues to rise in WA. And later, Dr. Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. For the first time in 5 years, the WA government has missed one of the public's top 3 priorities, cost of living relief, according to WAMN News budget priority poll. While health and housing received major funding in the 2025-26 budget, cost of living support fell to 5th, mainly due to the removal of the $400 electricity credit. Reporter Paige Rich presents the exclusive results and compares public priorities with government spending.
Another year has passed and the budget reveals the government is performing well financially, with surplus forecasts over the next 4 years. But for the average West Aussie, WAMN News' budget priority poll, now in its 5th consecutive year, continues to confirm that bread and butter issues remain the top concern. This year is no different. Viewers were given 15 options to prioritise, ranking them from the most important to the least important. Here are the final results. Health and mental health came first 4 years in a row. Cost of living and household relief comes second. Rental housing and homelessness came third. Elderly and aged care fourth. Police and law and order get the 5th place. Education and jobs training in the 6th spot, followed by regional development, family domestic violence, pay down debt, and then veteran affairs. Small businesses assistance ranked 11th. After that, public transport and infrastructure, climate change and environment is 13th. Then it's community issues, and finally, youth and First Nations wellbeing came last. As the state government's electricity credit officially concludes this financial year, we ask viewers whether they believe that the electricity credit from the state government can't last forever. For the first time in the poll's history, it is a deadlock, with 50 saying yes and 50 saying no. Now, let's compare your priorities with the government's agenda side by side. Total spending on health is $14.2 billion, ranking it number 1. Education and training jumps to 2nd place with a total investment of $8.4 billion this year, an increase of $1.5 billion. Housing ranks 3rd with an additional $1.4 billion in spending. The Made in WA Infrastructure Initiative comes 4th, also receiving an extra $1.4 billion. Cost of living relief ranks 5th with $963 million allocated, mostly due to the withdrawal of the $400 electricity credit. This figure also includes solar subsidies as well as student payments and public transport fare concessions. For the first time in the 5-year history of this poll, the government has missed one of our viewers' top 3 priorities, cost of living relief. Based on the spending allocation, this priority was replaced by education. Here is what Deputy Premier and Treasurer Rita Safiotti has to say.
We're supporting households with things like, for example, the student assistance payment that didn't exist a few years ago, with our 2nd round is currently being distributed. We're also supporting households in relation to things like our battery scheme. Now, our battery scheme is not only about rebates, but it's supporting low and middle income earners to get those batteries. There's a whole raft of initiatives. Those households may have kids that play sport, and we've got a $300 kids sport voucher.
Overall, the government is set to post a $2.5 billion surplus this coming year, with projected surpluses between $2.4 billion and $2.8 billion over the next 4 years. Despite this, power and water charges will rise by 2.5%, car registration fees will increase by 5%, and the emergent service levy will also go up by 5%. These increases are offset by the freeze on stamp duty, a reduction in public transport fares worth nearly $400 and a $150 electricity credit from the federal government. Paige Reid, WAMN News.
West Aussie families are set to lose the $400 electricity credit that has been in place since 2020, introduced at the start of the pandemic, as the cost of living remains a top concern. So, how did the government respond to your top 3 priorities in the polls, and how will this budget shape the agenda for the next 4 years? Here is Peter Kennedy.
The first budget after an election should set the agenda for the government's next 4 years. And this is what the government has tried to do. With the significant areas such as health, which has shown up in the WAMN survey as a major issue, huge amounts will be spent on hospitals to improve health services throughout the state. Very important, and very important to cut waiting lists as well. Cost of living, the government has said that it's containing household increases, taxes and charges. However, the tariff subsidy for electricity has been dumped, not surprisingly, straight after an election. That will add to living costs because power charges will be very, very significant. And the issue of housing. The cost of housing and rentals has gone through the roof. Public housing been in very short supply. The strong population growth, the strongest population growth of any state, has outstripped the ability of the housing market to meet its needs. So housing prices have gone through the roof, and public housing has been left lagging. So these are the big challenges for the government over the next 4 years, and the $13 billion infrastructure plan, very important with regard to public housing, but also major services throughout the state. When it comes to public housing, very important is the issue of skilled workers. The government needs not only the skilled tradespeople to build the houses, it also needs the materials to build the houses. Land has to be released in adequate supply and at a reasonable cost for the houses to be built over the next few years to meet the pent-up demand. Very, very important. So as far as the government is concerned, it's aimed to set the scene for the next 4 years, the third term of this, the third 4 years of this Labor administration, and they will be assessed by the success at the end of the 4-year time. But the issue of cost of living remains very important. The issue of services, housing, education, hospitals, those sorts of things, and transport services as well. They are key priorities for the government, and the government will be judged by the success of this program over the next 4 years. That's the challenge for Roger Cook and his team. Peter Kennedy, WAMN News.
After the release of the 2025-26 state budget, the opposition sharply criticised the Cook Labor government's priorities. Shadow Treasurer Sandra Brewer condemned rising payroll tax, set at the highest rate nationally, and infrastructure delays, arguing these hinder business growth, housing supply and job creation. Brewer highlighted the government's focus on large projects like Metronet and a racetrack, which he said diverts resources from urgent housing and workforce needs. Meanwhile, Shadow Education Minister Liam Satari criticised the budget scrapping of the free venue access initiative, which helped families afford swimming lessons vital for child safety. Satari and Brewer jointly criticised the government's choice to fund the costly racetracks over essential community programs and support for vulnerable women, calling the budget decision arrogant and misaligned with public needs.
The 2025 WA budget includes a plan to let general practitioners diagnose and prescribe ADHD medication, aiming to ease long wait times and improve access to care. Dr. Carl Hoaf from the AMA WA supports the reform, but warns it lacks crucial infrastructure, including GP training, Medicare rebates for assessments, and clear referral pathways to specialists. He emphasises that ADHD is a complex neurodevelopmental condition, and without appropriate support, the changes risk being ineffective. Dr. Hoaf calls the broader medical education and investment to ensure the reform improves outcomes, particularly for disadvantaged patients struggling to access timely and affordable care.
We think it could have gone a little bit further, and we continue to seek some support and investment around educating and supporting general practitioners in the management of ADHD. We know it's a big problem, and it's going to require coordinated care between public specialists, private specialists, GPs, hospitals, and there's still a bit of work to be done, but we acknowledge their commitment and acknowledgement of ADHD once again.
Police have released CCTV footage from Rockingham Hospital appealing for public assistance after a 51-year-old man was found collapsed outside the emergency department with multiple gunshot wounds and leg burns just before 10 p.m. on the 15th of May. Authorities say the man has links to the Comanchero outlaw motorcycle gang and believe the attack was targeted. He was transferred to Royal Perth Hospital's trauma unit for urgent treatment, then released and now recovering. Gang crime squad detectives want to speak to the occupants of a black Nissan Navara and a white Hyundai Tucson seen swapping vehicles at Auburn Grove train station. They are also seeking information on a grey Holden ute that entered the hospital car park, license plate 1BFC 417. Anyone with information is urged to contact Crime Stoppers.
A 34-year-old man has been charged following an alleged gun crime in Karawara on Thursday, where a 21-year-old man was allegedly threatened with a firearm at a construction site. Police say the two men were known to each other. The victim reported being threatened and struck in the face, sustaining minor injuries that did not require medical treatment. The Tactical Response Group, Regional Operations Group and Police Air Wing were deployed to the area in response. The suspect was later arrested on Caulfield Street in Gosnells. A gel blaster was found at the scene and seized by police. The man has been charged with being armed in a way to cause fear, common assault, and carrying or possessing a prohibited weapon. He was refused bail and appeared in Perth Magistrates Court on Friday.
And now here's Dr. Andrew Miller with his weekly medical and news commentary.
Hi, thanks for your time. Sometimes in our community we find ourselves having the same arguments over and over again. One of them is about smoking. We see at the moment the New South Wales Premier is suggesting perhaps we can reduce tobacco excise because not many people are smoking anymore now that the cost of the cigarettes are around $35 to $45 a packet. A lot of people just find it completely unaffordable. That, of course, has resulted in a bit of a black market for tobacco, but that's a policing issue, and therefore the solution is not to lower the price of legal tobacco, which is what the big tobacco companies want us to do. The solution is to have better policing in place to clamp down on the black market like we do for illegal drugs. We also see this in vaccination. So with the COVID vaccine, some people think that the COVID situation is well under control and therefore they don't need to worry about COVID vaccines anymore, but nothing could be further from the truth. As time goes by, our immunity to COVID wanes and there are new variants coming out all the time. So it's important that you check your eligibility for a vaccine, particularly if you haven't had one in the last 12 months or if you're in any of the at-risk groups. And get along with your vaccinating. The same thing also with things like the measles vaccine. We can sometimes be put on medications and think that they've solved the problem if our blood pressure's come down or our reflux has gone away. But you should talk to the doctor before you stop those medications, because very often the reason those problems have gone away is because you're continuing to take your medication. Thanks very much for your time.
And that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
Remember to subscribe to the WAMN Extra News Club, wamnnews.com.au/news/extra, supporting independent local news, keeping democracy strong. From Melly, Page, Peter, myself, wish you good health, good night. See you next Sunday.
Thanks for watching.